Hello, my name is Shatara Fulton, and today I'll be explaining why HBCU should not return to campus this fall 2020. Due to the worldwide pandemic known as coronavirus, all schools and businesses deemed as non-essential have worked remotely. As the fall semester approaches, many schools are developing plans to return to campus with social distancing measures in place. Coronavirus has continued to cancel and change what is considered normal. Impoverished communities have been hit the hardest. Black and brown communities have been affected the most during this pandemic. Black people are at a greater risk of being infected with coronavirus and have an even larger mortality rate than the white majority. In this video, I will explain why historically black colleges and universities should not return to campus this fall 2020, my reasons for my claim, and my supporting evidence. When you think about the demographic for HBCU, you think of the name. Historically black college. Black students are the majority. There are other students at HBCUs, but black people are the majority. Coronavirus has continued to affect black people at a disproportionate rate. Disproportionate meaning that although there are less black people in the United States, more black people in the United States have been infected with COVID-19. One reason for this is most minorities work essential jobs. The jobs deemed as essential at the beginning of the pandemic that the world would not continue without these people. So when you think of that, you also think of them working remotely. Well, that's not an option for many minorities because they have less workplace flexibility than other jobs. Jobs like a lawyer, you could probably work from home. You can consult people from home. But working at Walmart, you wouldn't really be able to work at Walmart from home. And also, they have less paid leave. So, say you have asthma or some pre-existing condition. You have asthma. You're less likely to be able to work from home if you have a Walmart job, and they more than likely won't pay you to stay at home. You probably won't have a job after the end of the pandemic, and that's really the reality. My supporting data: black people are 3 times as likely to get infected with coronavirus, have 6 times the mortality rate of the white majority. In this, you'll see that black Americans lead the board with deaths with coronavirus. So for every 100,000 people, 92.3 black people have died, as comparison to the white majority, only 45.2 have died. And that's because of a lot of different issues, and I'll explain that now. But before I explain that, location of an HBCU. HBCUs are located in the center of impoverished areas because they are to cater to those impoverished areas. They are for the black and brown people. They were created so that they could get a higher education. The black community is neglected. Systematically, the black community is neglected. Schools in the black communities are neglected. They are underfunded. HBCUs are schools in the black community, and they are underfunded. They also are not, compared to a white community, they probably get their air tested for pollution and chemicals in the air. But black communities have not been tested, and they have more factories in their communities, but those chemicals have not been tested. Environmental and health cares contribute. Black people do not trust the healthcare system. That's not at the fault of black people. In history, black people have been abused and neglected. Black people have been used as test subjects from the healthcare system. Also, when they are neglected, their pain is not really acknowledged. When you go to a hospital as a black person, they probably think you're trying to get pills and drugs. In reality, they don't take your pain seriously. Chemicals in the air, as I spoke of earlier, that could possibly be the cause of the disproportionate respiratory disease in the black community. Meaning that these chemicals from those factories that I discussed earlier, the workers go home to their children and they're exposed to those chemicals. Who knows what those chemicals could be doing to their children and to them. Pre-existing conditions and their effects. Some pre-existing conditions are diabetes, asthma, cardiovascular diseases, and immune compromise. The immune compromise are those that have been previously sick or sick now, like people who had cancer or who have cancer, or people who have sickle cells. That also affects the black community, so those immune compromised are also at risk. The death rate for COVID-19 patients with pre-existing conditions. So if you have a heart disease, you're at a higher rate. If you have respiratory disease, you have 6.3% of people dying from their pre-existing condition combined with COVID-19. The effect. These conditions make you more vulnerable to the sickness. Yeah, anybody can get sick by COVID-19. That's not what I'm saying. I'm saying that your immune will be more hurt if you have already had these conditions, or you have these conditions and not know. Like, cause my dad personally, he thought that he wasn't on this list, and he's recently been diagnosed with diabetes, which that means that he has to be more careful at work now. He has to maybe decide to not go to work anymore. It also makes it harder to recover. If you have these diseases, your immune is already harmed. Your immune is already weak. So that means that this combined with coronavirus could really be deadly for you. And if you do survive, your recovery will be for a very long time. You won't just recover after a couple weeks. It probably take years for your body to recover. Uncontrollable factors. Students attend colleges. You cannot control a student. You might say, I'll say to help prevent it, I'll say, you can't leave home, you can't leave to go home. But then you have funerals and you have other family things that those students might not want to miss. Also, because students don't really listen. They listen to a point, but if it's for their good, they're going to do what they need to. Also, because waves of sickness throughout campus. When you're on campus and it's flu season, for example, it is so hard to not get sick. You have to wash your hands constantly. Even when you're washing your hands, you have that faucet that a lot of people have touched, that toilet that a lot of people have touched, that shower handle that a lot of people have touched. So you're still at a greater risk of getting this sickness, because colleges, they are clean. College campuses and dorm rooms and bathrooms, they are clean twice a day, but you don't know who just got out the shower when you get in the shower. So it's like you're still at a risk. Most students are essential workers. 70% of students have part-time or full-time jobs. And another thing with working while you're on campus and you're staying on campus is you go to work and you work these essential jobs. You come back to campus and you put everybody else at a risk. But you also have to support yourself while you're on campus. A lot of things that you need are not provided by the schools. So that's why students get part-time and full-time jobs, but outside of their school, because they need the money. So you can't take that away. In conclusion, HBCUs should not return to campus this fall semester, because the number one priority for a school should be its students. In the HBCU, their students are majority black. So with that being said, I hope that this was educational and you learned something. Thank you.